With our today's topic of orthodontic, that is anchorage. So the anchorage word is what's given by the Alexis Scalenge. This is a direct MCQ ask. The anchorage term is coined by the Alexis Scalenge. So what is anchorage? The anchorage is the nature and the degree of resistance to the displacement, nature and degree of resistance to displacement offered by an anatomic unit when used for the purpose of the affecting tooth movement, which is simply means that the resistance to the any unwanted tooth movement is called as a anchorage. Resistance resistance to any unwanted movement is called as a anchorage. So the types of anchorage, there are various types of anchorage. First is the simple anchorage. Then there is a stationary anchorage. Third one is the reciprocal anchorage. Then intraoral and extraoral anchorage. Then there is a multiple anchorage. Then cortical anchorage, muscular anchorage, and absolute anchorage. These are various types of anchorage we have to see in the lecture. First of all, what is the factor that affects the anchorage? There are two types of factor. First is the biological factors, and second one is the mechanical factors. Mechanical factor. In biological factor, there is a size of the anchor unit. Size of the anchor unit is the first biological factor that affects the anchorage. The anchorage value is depend on the size of the anchor unit. Increasing the number of teeth increases the anchorage and minimizes the unwanted tooth forces. Second is the axial inclination of a teeth. Axial inclination of teeth. Distoaxial inclination of a lower posterior teeth is better in the anchorage control when compared to the mesial inclination. Distoaxial inclination of the lower posterior teeth. Distoaxial inclination of lower posterior teeth. Third is the delaying of the extraction of a teeth. Delayed extraction of a teeth. Use of a optimum forces. Then the abnormal muscular force or persistent habit. Then anchorage savers. We have to discuss this anchorage saver in further topics. These are the adjective procedure, that is adjective procedures, like the transpalatal arches, then lip bumpers, non-palatal arch, headgears, functional appliance with fixed appliances, as well as a delaying extraction are the adjuvant procedures, which is also a factor, biological factor of anchorage. Then teeth, a multi-rooted teeth is a more resistant to displacement than the single rooted. Then the longer rooted teeth is also more resistant. Then the triangular shaped root is also more resistant than the conical one. So these are the biological factors. Then what is the mechanical factors? Mechanical factors. First is the friction. Friction is an important mechanical factor. The author Tidy is given the opinion that the frictional resistance increases the strength on the anchorage unit. Friction resistance is high. Friction resistance is high with the nitrile wires, the ceramic brackets, whereas friction resistance is low in the stainless steel brushes. Then second mechanical factor is the type of tooth movement planned. The frictional resistance is more with the bodily movement. Frictional resistance is more, and during space closure it is also more. Space closure, the friction resistant is also more. Then technique employed. Third is the technique employed. The friction varies depending upon the retraction mechanics employed in the fixed appliances. It is more in the sliding mechanics. It is more in the sliding mechanic. First type of anchorage is a simple anchorage. What is a simple anchorage? It assessing the resistance value of the anchorage unit. Another way to express this in the approximate surface area of the root proportion. A root with a large surface area is a more resistant. Root with a large surface area, more resistant to the anchorage. In the multi-rooted tooth, also it is more resistant. Triangular shape root also more resistant. Simply simple anchorage is a resistant to the tipping force. It is a resistant to the tipping force. Resistant to the tipping force is a simple anchorage. Resistant to the tipping force is a simple anchorage. Then second one is a, and it having a anchorage values. So the posterior teeth having a more anchorage value than the anterior teeth. There is a MCQ asked based on the image based question. They are giving the gives you the first molar, second premolar, and second molar, and here the anterior incisor, and they ask that uh, which of the following have has a greater anchorage value. So the posterior teeth has a having a greater anchorage value than the anterior teeth. The most highest anchorage value is of a first molar, upper first molar, that is the 450, and the least anchorage value is of a central incisor, lower central incisor, that is the 170. Then what is the stationary anchorage? Stationary anchorage, it is the anchorage unit displaces the anchorage unit bodily in the plane of a space, displaces the anchorage unit in the bodily displacement, so it is a stationary one. The example of this is the retraction of maxillary incisors. Retraction of a maxillary incisor using the first molar. It is an example of a stationary one. There is a direct question MCQ, that is the example of a stationary one. Stationary is the bodily Stationary, in that the anchorage unit moves bodily, and example is the retraction of the maxillary incisor with the help of the first molar. Then third type of anchorage is the reciprocal. Reciprocal is a simple entity. Reciprocal means if there is a two teeth here, they are reciprocating. Equal and opposite force are there. Example of reciprocal is the midline diastema case, where the two central incisors are dissipated. The equal and opposite forces tend to move each unit toward a more normal position. Other example of this is the correction of a class 2 malocclusion, where the intermaxillary elastics are used from the maxillary one, correction of the class 2 malocclusion. And third example of this is the correction of the posterior crossbite by the use of a through the bite elastic. Use of a through the bite elastic. There is a equal and opposite forces are dissipate in the reciprocal anchorage. An example is the midline diastema, class 2 malocclusion case, and the posterior crossbite through the bite elastic. Then there is a intraoral anchorage as well as a extraoral anchorage. Intraoral anchorage, we have seen that the simple anchorage, reciprocal anchorage, as well as a stationary anchorage, these all are the intraoral, means in which all the resistant units are situated within the oral cavity only. Even within the oral cavity, the palate, the muscular forces, the inclined planes of the teeth maybe form intraoral anchorage. Which is the extraoral anchorage, in which the one of the units is situated outside the oral cavity. The use of a cranial, occipital, cervical areas of the plaster, the intraoral resistant unit is one of the oldest forms of the orthodontic therapy. In this, no movement of the anchorage unit. The example of extraoral is the correction of basal or maxillomandibular jaw mal relationship, that is it in the skeletal class 2 and class 3. Skeletal class 2 and skeletal class 3 therapy. Then move further, intramaxillary anchorage is in this anchorage in which the resistant units are all situated within the same jaw. The illustration used to describe stationary anchorage is an also the example of a intramaxillary. Stationary anchorage is an example of a intramaxillary anchorage. Then the intermaxillary intermaxillary anchorage, in which the units situated in the one jaw are used to effect the tooth movement of the other jaw. Units situated in the one jaw and used to effect on the other tooth of the other jaw, means upper and the lower one. There is a classic example for the intermaxillary anchorage is the Becker's anchorage. Becker's anchorage. Becker's anchorage is the class 2 elastics and the class 3 elastic. Many times the MCQ ask about the Becker's anchorage. What is the Becker's anchorage? In the class 2 elastics, there is from the lower molar to the upper canine. Lower molar to the upper canine is a class 2 elastic, and class 3 elastics is the low upper molar to the lower canine is the class 3 elastic. Then other type of anchorage we have to see in the another lecture. Stay tuned. Happy studying.